When you think about the patient journey, where do social workers make the kind of difference that no other discipline can?
So, how do social workers in healthcare make direct practice changes, differences, and improve the lives of our patients and families? Social workers are vital and critical to the care team. On the obvious level, is that we support our patients and families through these very difficult life challenges. And what does that really mean? It is anything and everything from helping them understand how to navigate a health system that they're very unfamiliar with, to understanding the illness and the treatments that are before them and making choices along the way, all the way through the challenges that illness and injury can have on one's life. So, their work, their school, the relationships in the family, they all get impacted. And then, of course, moving toward the end of life, those really challenging and hard choices that need to get made as that family with the honor and respect of the person impacted.
So often we're dealing with complexity, 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 getting through the sometimes craziness of the healthcare system step by step and not fully understanding, no matter how literate some people may be, they're not necessarily health literate. They don't understand the importance of primary care or social care issues, that it's just as critical to for people to ask questions about, do you have food on your table? Do you have a roof over your head? And those things matter. Those things do make a difference. Now more than ever, when 10 times in a week, when a social worker has dealt with the same broken aspect of a system, how do we raise it up a notch and then advocate for system change so everybody's lives will be a little better and different and people will be able to get the chance to be healthy?
Why is it folks get well when they're with us and unwell when they go back home? And we, of course, recognize that that was social determinants. Those are those housing, food security, and more importantly, the insecurity of that. So, how is it that something is happening, multiple states away and distance from each other, but the topic, content, and impact was exactly the same? It's because our social determinants of how people live, where they live, and the context for which they live directly impacts how they are within their own health and whether or not we can prevent illnesses. And so part of the social work is a component of that. It's preventative care. So there's lots of things we can do directly as social workers in the social arena for preventative, but we can also make a direct impact on good health behaviors and knowledge about health. And so there's a big component that we have in the realm of education.
Social determinants of health as it's sort of understood today, and how has social work changed?
Yeah, yeah. When I think back on when I studied social work to now and how I think social workers, what's different now and what I missed was the importance of learning about return on investment in business cases. I think that was so not relevant when I went to school, but should be relevant now because I think I've spent so much of my career, and particularly in the healthcare arena, having to prove our worth. Nobody realized that's what we've been doing and talking about our whole since the beginning of those discussions that Louise just talked about. So it's an irony in all of that.
But please say more.
I agree that that was a great statement. It's so unfortunate. So the content of it, in particular, to the vital importance that social workers have a voice on macro issues, on public policy, that we incorporate our knowledge and understanding as the voice of patients and families, as a collective statement, that we insert and make sure that we insert who people are so that public policy is really acknowledging the value and the importance of people and how we craft services for those most in need. And I might call, an expectation or an incorporation that every social worker has a responsibility to raise the voice up of their respective client, patient, family.
It's not just good. It's not good enough just getting to the table, but it's what you say once you get to that table.
Well, tell me what you would say. So, let's say if you were talking to a CEO of a major health system with, let's say like just millions of lives under their system, and they're talking to you, and maybe they don't know anything about social work. What's some things that you would want them to know?
So I had an executive level uh, impacted by cancer in their family, and they needed support. And it was the work that we did one to one. So some of that was very behavioral health related, and some of that was navigating a system level. What does it mean like to be a patient in a large organization? How do you navigate through to make sure all the appointments line up appropriately? Some of it was understanding, frankly, the insurance. So somebody had purchased a long-term care policy and needed to understand how to operationalize that policy. And some of it really was coping day to day with the fact that this person needed to be pulled away from their business to tend to the love and care of the person they was impacted by cancer. And it was also their interpersonal relationships within the family that was now getting directly impacted. So here's the son who's now becoming a caregiver in new ways that he never expected. At the end of that work with that gentleman, who was again executive level of a business line, his response was, I had no idea what social workers did. And now I have a full understanding because I had a personal impact. He said, I don't even know how to frame this up to tell my story to somebody else. And I've lived it. So part of our challenge is finding the right words to communicate what it is that we do so that it's tangible in a way that the receiver can totally understand it and incorporate it. It's finding language that's we can easily repeat it in an elevator pitch.
We really need to have very clear metrics as to how we make a difference in readmission rates, length of stay, all the things that matter to the CEO at the end of the day. And of course, each CEO has different pressures based on how much fee for service payers they have in their mix versus value based, all of that. But you have to drill deep and figure out what is the highest priority of the day. And at least at my institution, I can say that those priorities shift from one month to the next. And all the more reason we need to have those numbers at our fingertips. And we don't all have that.
It's trying to, sort of take this vignette I shared with you, sort of take that story and put it into a numeric value so that it can be delivered and a dollar attached to it, right? So lots of judgments get made, lots of filtering of how you're collecting this data and what does it really mean. At the end of the day, I try to sort of teach if we begin a sentence with for the value of patients and families, and we end the same sentence with the values for the patient and family, if we stay in those two guardrails, the work that we do will have value and genuineness to it. But it is really difficult when you're trying to package that up into some sort of formula that will validate a staffing model so that you can care for patients appropriately. Regardless of setting, how do we determine the number of staff critical to the care of these patients? And that's the work at hand. As a profession, unlike some others, we haven't framed ourselves in the same way so that we have metrics that we can really put our feet on, that we have the ability to really name out that the minimum number is X. And that's the work ahead for us. We have got to sort of claim our space. We're not doing it because we think we want to employ more social workers. We're trying to employ more social workers to care for patients and families. And I think if that's the lens that we use, that really keeps us honest.
Yeah.
Well, let's
Love that.
yeah, let's take it then for a minute. Let's remove social work. Okay? So I can think of some times when I've seen entire social work departments be eliminated and replaced with other professions, as I'm sure you all have as well. Can you tell me about a time when social work as a that role was dismissed, diminished, and what the impact of it was?
Because we are not by profession a revenue or fee based service. We are part of external costs of doing business of healthcare. And so this pendulum swings a bit, I think is really about what gets lost in that translation. If my metric is that we want to reduce a length of stay, so I want a shorter length of stay so that another patient can occupy this bed, then that becomes the value. How short is the length of stay until the next person gets into the bed? And if that's what's driving decision making, and that's what's the value that you place on that activity, then that is really a clean sort of mathematical metric. The space that we live in is about the person in the bed. And so social work really speaks about, yes, we want the bed to be occupied for the shortest length of time because the longer you stay in a bed, in a hospital, the less quality of life, the less abilities that you will have at discharge. So we don't want you in the bed for very long. We want you out, home, preferably, and well, right? So that becomes the driver. But we want to know about the person in the bed because we care more that they don't come back. So ensuring that we understand who's in the bed, the patient themselves with the wristband, but their family is our patient number two. So we have to know about the family. We have to know where they live and the challenges that they have. So our metric gets very different for social work. We still value about the shorter length of stay, but we more importantly value who is the person and who is the family so that we can ensure the best delivery of care. So you can hear that it's similar, but the metric is quite different.
We're so needing to be on our toes, aren't we? In ways we've never had before. It's just gotten so intensified.
Instead of calling a social worker to have somebody, like for example a homeless patient, somewhere to go when they discharge, instead they call security. Shorter, it gets them out faster. It there's a differential in FTE there. It's fewer resources. If it still gets to the same outcome with a lot more
Well,
efficiency, what's
it may
really
get
the
to a
harm
short
there?
term. It may get to a short term outcome, and it's a band aid.
Tell me
Let's
about
say
that.
it's a band aid because it's going to come back. If the security person finds a way to get the person out, fine, they'll come back because the needs are still there. And if we had helped, maybe we would have found a more permanent place for that person to live that they wouldn't be repeating their visit to the emergency department, for example. And I think sometimes we're so short-sighted to think that that's what matters most is the immediate,
So an unfortunate lady arrived, found down on the street, came in through the emergency room. We weren't really sure who she was because she had been living on the street for some time. So her belongings, while she was found down, not all her belongings came with her. She was diagnosed with malignancy and came over to our adult oncology. And in working with her, we were able to figure out her identity, work with her about where she originated from, which was not our local area. We were able to locate through a lot of detective work. So, the internet has opened up a lot of detective abilities for us to figure out who might a relative be in the hometown that she originated from, found family, and reconnected them. That homeless lady, to your good point, could we have just simply discharged her to a regional shelter and closed the chapter? Sure. Sure. The value of social work is that that's not enough. At that shelter, she's going to become more ill and she'll come back to the emergency room and we'll just rinse and repeat this chapter again and again and again. But we look for solutions where they're obvious. We hunt them down when they're not so obvious. And we try to make connectedness happen again for humans, for people. So again, it's this idea of are we moving a widget out of a bed to somewhere else, or are we helping patients and their families craft a better way, a different plan and get them the resources that they need so that we don't rinse and repeat this story. And if the person does come back, they're coming back for a medical reason, not a socially driven reason. And that again, as we age and as end of life becomes more of the part of the plan of care, that we again layer in enough resources so that end of life is done and delivered in the best way in the right environment of care for the sort of the right time, the right reason, for the right purpose, right? So that we sort of right size everything that we do.
I love that. I love everything about what you just said, but specifically the widget part, because that is sort of how it feels sometimes. And also about the non-obvious, because and I think there's something to that there, because in healthcare we want these immediate results, especially when you're dealing with large volumes of people and various complexities. So, sort of the easiest, most attainable answer is the most attractive one. But there social work is a lot of there is a lot of non-obvious solutions there, and one thing that sort of came through my mind as you were speaking is in the ED, and where we have the same patient cycling through various times. And the first time I meet him, maybe he screams at me and maybe he throws a urinal at me. And the next night, it's maybe he lets me give him a blanket, maybe a turkey sandwich before he goes. And then the next night, maybe we're able to engage into a more meaningful conversation and, hopefully at some point get him off to detox. There is that non-obvious process of building that rapport and establishing trust, and I'm a safe person, this is a safe place, that really precipitates where that real intervention can happen, and a successful outcome can be had. So I just
So
wanted to
many,
talk about that for a
Christina,
second.
that was such a good example. No one, so rarely, except for us, do people see the value in that relationship.
Yeah.
And, how do we quote unquote monetize the value of that relationship to get it across, get it through people's heads of what a difference that makes? So that was a beautiful example of how you
Just
create
as
change. Yeah.
sometimes we get called as social work departments or individuals because there's a very tangible need, a cab, transportation, some sort of vehicle to get person from this location to a home setting, right? And so social workers might find that offensive to I only get called for a cab. And this, back in my early days, that was just kind of a common thing. Call the social worker, they need a ride. And to your really good point about a blanket and a sandwich, it's the same concept. You could simply say, go to X person, they'll order the cab. Or you could ask why it is you need the cab. Tell me about the fact that there's no viable transportation, that you don't have anybody that you can contact or call to come get you. Are they busy? Are they at work? Or is there no one? Are you living a life of isolation? Are you alone in the world? That could be the symptom to understanding that he really is alone. That he lives in an elder high rise, that he goes in his apartment and is afraid to come back out and only comes out when he is medically in need and actually found down on the ground. And that precipitated the need to come to the hospital through the emergency 911 service because he was found down. And now we've sent him back home in a ride without understanding how he got here. The widget concept is just to get a ride. Robin's concept of understanding who he is and understanding everything about him is really what social work's about. If we widget him and give him a ride, we've done him no service and we've done absolutely nothing to impact his life. In the care of people and those who care for them, their patients and families, in the care of them, the honor is to understand who they are in the context and make a difference. And that's what social work in healthcare does.
Well, social work is not billables. Basically, in claims data, we're invisible. We don't exist because maybe we facilitate these tasks, like de-escalating a suicidal patient, or that's H2011. And then there's coordination of housing, medications, and food. But that's billed under a doctor's NPI. And nurses also aren't billable, but they have their nurse sensitive outcomes, they have trust, they have cultural recognition, they have their Daisy awards, PT and OT, their productivity is tracked. And then you have revenue cycle staff which don't bill, but nobody's questioning whether or not they're necessary. We know that they're needed. So it's only social work that has that both of that high clinical impact and then the measurable financial value.
But don't underestimate, Christina, the work that the coalition has done in trying to get reimbursed for some of what you're talking about. So that's been a big part. And
So
we've had some success and have a bill running through Congress and that will hopefully get through.
yeah, tell us about that.
Yeah, it's very much trying to get reimbursed some of what you just described that often doesn't get looked at as reimbursable. So in the fee-for-service world, there have been some codes that social workers have been restricted from utilizing the health behavior and assessment codes, assessment and intervention codes. And we have really tried to get to the bottom of that and try to change that. And we've had a great deal of luck being heard by Medicare and Medicaid. And this bill that we're putting through, changes have been made, but the bill would solidify a lot of the faultiness that got us to where this problem is.
I think I see it 4185.
I
I think that was a great note to leave off with. Thank you so much for your times today, and thank you for your leadership.